So after thinking about all the different hypotheses in which women's health can be affected in chronic diseases, I'm going to shift gears and talk about a little bit of an unsavory topic, which is female genital circumcision or female genital cutting or female genital mutilation. I'm going to use those terms interchangeably. And we're going to talk about the context of Egypt and really the medicalization of the practice, which is one of the reasons it fits into this conference. So for those of you who don't know about female circumcision or female genital cutting, the WHO has categorized 4 different kinds of activities that fit into this. The first kind, it's the mildest. It involves the excision of the prepuce with or without excision of part or all of the clitoris. Type 2 is the excision of the clitoris with partial or total excision of the labia minora. Type 3 is an infibulation. It's an excision of all the external genitalia with some stitching to narrow the vaginal opening. And type 4 is a slew of all sorts of things with the intention of tightening or narrowing the vaginal opening. This is actually commonly practiced, especially in Africa. It's thought to have originated in the Nile Valley and spread across the Sahel to West Africa and down the Horn of Africa to East Africa and across to the Arabian Peninsula. I want to point out the country that I'm going to be talking a lot about is Egypt, where prevalence of all women aged 15 to 49 in the DHS, there was 91% of these women were circumcised or had undergone through this procedure. To give you a little bit more background on the context of Egypt in particular, this practice is thought to date back to pharaonic times. It was universal until recently. I'm going to show you some data about that. And it was passed down across generation by women. This is a really important point because while the practice, if you think about it, is really a reflection of an entrenched patriarchy, it's the women who then do this to their daughters. It's the grandmothers who suggest that they do this. And it's not because mothers don't love their daughters, because they do. It's because they see it as a way of protecting their daughters. And previously, this was really done within households, and that is changing, which is one of the things I hope to talk about. And girls are usually circumcised between ages of 8 to 12. If you ask mothers, 75% will say they'll remember the day. So it's very different in that context than male circumcision, which is done usually at an age where boys might not remember. And in the context of Egypt, the severity ranges, but there's not a lot of infibulations. It's usually type 1 and type 2. And there's been a rapid increase in the medicalization of the practice. Meanwhile, there's been lots of efforts dating back to the 1950s to stop this practice, and I'm going to show you some data to this effect. So if you were born in 1988 or before, there was a 90% chance that you were circumcised. A lot of the younger people in this room might be in those age groups. And since the 1990s, the practice has really come down pretty precipitously, but it's still practiced. It's still quite common. There were laws in the 1950s and the late 70s banning this practice without a medical need that went largely unenforced. Then in 1994, there was a national conference that sparked a national debate about it, and there was a lot of efforts to stamp this practice out. In 1997, there was a new ban, but it still included a medical loophole for medically necessary circumcisions, or female genital cutting, and it was only in 2007 that this loophole was closed. I won't go through this, but if you look at age-specific cohorts, you see the trends that there really is a drop in this practice. So that's the good news. The bad news that it's becoming increasingly medicalized. And that the early messages against female circumcision were targeted at the early immediate risks. So they weren't talking about complications in pregnancy 20, 30 years later. They were talking about death. And what that did is it inadvertently promoted the notion that a medical practitioner can perform the procedure and mitigate risks. The particular problem with that is that medical personnel have a lot of authority, and they can institutionalize a practice and potentially legitimize it. And that's something that WHO is really worried about in all the countries that practice female circumcision. Now, Egypt is a particularly interesting one because if you look at most of the countries where this is practiced, Egypt is the most medicalized. So if you'll recall, I told you the prevalence is quite high, and that that the most recent data show that it's medical practitioners who are really doing this. And again, looking over time, there's an increase in the medicalization of this. So I'm going to talk a little bit more now about a small research study that I've done looking at this emerging question. Given that women are interacting with doctors, given that this used to be in the realm of household, given that doctors know this is illegal, what's going on? Who's deciding whether this practice continues? And we did a mixed method approach with 410 quantitative surveys and 29 in-depth interviews, which I'm going to go into in just a second. This data was collected just in February of this year. We wanted to talk to young mothers, women who are actually at the point of making this decision. So we reached out, we did a random sample of 25 to 35-year-old women in a religiously mixed area of Cairo, just outside of Cairo. We had an urban and rural area. The daughters were likely to still be of pre-circumcision age, but some had already gone through circumcision. And so we wanted to capture both intentions and actually completed circumcisions. And we wanted to ask in detail about the mother's decision. Just to tell you the differences between Christians and Muslims, there is a really big difference. If you look at Christian mothers and their daughters, these are the Dyads. While Christian mothers were circumcised, they are choosing not to circumcise their daughters, whereas Muslim mothers who were circumcised are still choosing to circumcise their daughter. And the same pattern holds in both the urban and rural area we looked at. Really, Christians are abandoning the practice, whereas Muslims continue the practice. And if you look at the medicalization, we also see that while mothers, many of them were done by a health practitioner, they say that they're going to get a health practitioner to do their daughter, or they have already chosen to have a health practitioner do their daughter. And these are up in the point of 90% for the urban area. So 90% of them who intend to do this to their daughter intend to have a health practitioner do it. Now, if you ask Muslim mothers, just an open-ended question, do you intend to circumcise your daughter? Some people will say no, some people will say yes, but a plurality now are saying, I will consult a doctor. So when we first saw this, we were taken back because we thought, well, this is just a cover. Mothers want to do this, they know it's illegal, this is an entrenched practice. They're just saying that they're going to consult a doctor. But it really could be that mothers have done this for a really long time. This is what they did. There's all this information about how this is harmful for their daughters. They might actually wonder, well, maybe my daughter needs this. And so they would go to a medical practitioner. And so we really wanted to tease this point out because it's an important issue in terms of how we would intervene. If we think that it's really the mother's preference, then we still want to target mothers. If we really think it's the doctors who have a strong influence here, then we want to target the doctors. So they have different implications in terms of what we would encourage, what we would want to do to stamp out the practice. So I just want to tell you that if you look and you divide up the reasons mothers give based on what their intentions are with regard to circumcising their daughters or not, the ones that say they want to consult a doctor, they say they don't know if the girl should be circumcised or not, and it's the right thing to do. Whereas if you look at the ones who tell you that I do plan to circumcise my daughter or I did, they tell you it's about custom and religion. So you do see these differences in their answers, suggesting that the ones who want to consult a doctor are really actually open to the doctor's opinion. And then we tried to get this even more critically. Now, let me just step back and say this is kind of a complicated slide, but what we did is we gave mothers hypothetical questions. We said, Sarah has a daughter of circumcision age. Her mother doesn't want to circumcise her, but the doctor thinks she should. What would you recommend Sarah do? And then the next question, we flipped it around. We said, I don't know how I just said it. We just flipped it around. And we saw how likely the mothers were to switch their answers. Did they always go with the doctors? Did they always go with the moms? Did they just stick to their guns and say, no, you should circumcise, or yes, you should circumcise? And what you see is, for the ones who say they want to consult a doctor, they're also the ones to always follow the doctor's preference. We did this same kind of question, but now with husbands. We said, okay, Sarah has a daughter of circumcision age. She wants to circumcise her daughter, but she wants her daughter to marry a modern Egyptian man, which has a connotation of, maybe not wanting to circumcise, and to see if there was any change. And the mothers didn't really follow the preferences of the future husband, but they really, really, really did listen to what the doctors say. And you see that the group that is questioning the practice is the one who's also more mutable. And now because we did a qualitative survey, it would be a shame not to show you some quotes from these women themselves. We asked, for example, one woman if she's talked to her neighbors, and she says, I listen, but I'm not easily convinced. My daughter, it will be the doctor who will be able to determine if she needs to be circumcised or not. And then there's some exchange about the diversity of opinions around her, between her relatives, and then she reiterates, I won't listen. I won't listen because I've made up my mind that the doctor will be the one that decides for my daughter. This is another quote from another woman, again, at the time, around the time where she's deciding for her daughter, for a 10-year-old, where there's a discussion of need. Well, I don't know what I'm going to do. If she needs it, then and the doctor is the one who's going to determine whether she needs it or not. I'll do it. And so why do you intend to circumcise your daughter if there's need? What do you mean by need? I'll have her examined, and if there's need. And so this idea that a doctor is using some sort of criteria to decide whether there's need or not, I thought that was quite interesting. And then another one, just from a rural example, she goes on to say, this is something that we were brought up with. This is something from a long, long ago, and we were brought up like this. But I will take her to the doctor first. I had her examined, so she's already had her daughter examined. But the doctor told me, no, she should still wait another year. So there actually seems to be, that everyone's really listening to the doctors, and the doctors are now active in this decision, even though this practice is illegal. So I want to come back to this issue of legality because, initially we thought, well, this is just a cover. Mothers know this is illegal. This is a reflection of their own preferences. But when we asked if is circumcision legal or not in Egypt right now, only in the highest wealth levels and highest education did women know that this was actually illegal. Otherwise, 60% thought the practice is legal, even though there has been lots of information. Again, we have to assume that what they're saying is sincere, but I thought that we would get very different results for this legality. Now, even if the mothers don't know whether the practice is legal or not, the doctors do. And so you have to start to think about, and again, I have nothing but respect for the doctors who work in very difficult conditions, but you have to start to think about what could be a possible incentive for doctors. And we asked about what women think the price of this procedure is, and across wealth quintiles, there is a price. There is a going price, and it's between 150 to 200 Egyptian pounds, which translates to $20 to $30, which translates to about 20 to 25% of per capita health expenditures in Egypt. So I'm not insinuating that doctors do this for money, but if we are going to try and stamp out this practice, and there's not a lot of legal enforcement, we also have to deal with the fact that there is a financial issue that complicates the matter. So I just wanted to present some of these preliminary findings on this study, and just to say that there is that it's great that female circumcision is declining in Egypt. That's fantastic. There has been progress. But there's now increasing ambiguity about what mothers should do, especially amongst Muslim mothers. And they're seeking out the opinion of doctors, and the doctors' opinions seem to be the decisive one. So in an area where there is very little regulation, when all of this happens in the underground economy, we should think about interventions targeted not just to mothers, but also to doctors. And I just want to end thanking all the people that made this possible, all the NGOs in Egypt who work on this every single day, our amazing survey team, and the Friedman Spigoli Institute for funding this initial study.